on the agenda here, we have a young man that I know his dad's ready, and two or three of his grandparents actually to take with him regularly. But Chad Thompson, he works for the city of Manchester now. He wants to talk to you a little bit about what he's done on this on drug prevention here in Clay County.
Excuse my appearance, I didn't think I was going to be speaking from the chamber.
I just called him. Absolutely, but we can start.
Yeah.
Since we've had a trouble with the drugs and the rest of the
Yeah, there's,
say what he's doing.
just to tell you a little bit about the program, I see seats from the council here. I just want to thank you guys again for voting the program in to the mayor. The city's been real helpful. We've made some progress in it, been able to pinpoint some trends in drug culture, especially shifts in trends, especially dealing with the influx of heroin that we see in the county. Coroner Finney can certainly tell you about that, I'd imagine. But right now, we have a total of 30 participants
Put
in
the
the
mic
program.
on, Chad, because we can't already hear you.
Oh, you can't hear?
Put the
Here, let me
mic
get
on.
up. Put the mic on. Where
It's not there. It's not there.
It's not there.
I didn't think it was.
We could hear
Yeah,
you.
I'll come up here. I don't like standing.
Okay.
There you go.
There you go.
All right. So we have a total of 30 participants in the program right now, 14 of which is in a facility from northern Kentucky to Alabama, about 50 miles before Birmingham, a small place called Gadsden and Atala. We work strictly with female or male facilities only. It's very gender oriented. I feel that's the best. Like I was saying, 14 is in a facility right now. We have 7 waiting to go to a facility to seek treatment, and another 9 that is just now getting their paperwork started. So far, we've had 1 person graduate from the facility. There is another male that'll be home next month, and he's been in for about 6 months. So he's getting ready to graduate from his program. We've only had 2 people that has had trouble accepting treatment and accepting that they have a problem, and they didn't do so well in the program. But that's not to say that hope is lost for them. It's just to say, everyone's different. So, we try to focus on programs that suits the individuals or participants' belief system, moral and ethical system. That way to give them maximum chance at recovery. There's already biases toward programs like this. We've had trouble out of rehabilitation programs over the past 10 years. Frankly, some are just businesses. So we try to root the ones out that are best for recovery. As far as that, we've been working at the high school, dropping off literacy that we've gotten from the NIDA, the National Institute on Drug Abuse, and the CDC as well. So we've been working on prevention at the high school, and with that sort of thing, I'm open to talk to anyone at the high school. I've been called down there a few times since August. I've been down there probably 5 or 6 times just to speak, not to mention the times that I have dropped literacy off there. The literacy I'm talking about it's written for teenagers. It's very easy to understand. It's very easy to read. It puts into perspective the way that they would understand it, such as heroin's effects on the body and the mind, nicotine's effects on the body and the mind, sugar's effects on the body and the mind, drugs that people don't consider drugs and that are as addictive, maybe not as dangerous, but can lead to other forms of substance abuse if not properly educated. But as far as that goes, you can educate people all you want to. It's really that's all you can do. So, but the program so far has been pretty successful. We've done all this on right around $700 of the city's money. So we've not been. I've not broke the city just yet, so maybe knows a little bit. She could probably tell you more exactly. I can tell you that when I have requested money, it's been to take someone to Alabama or to get them a bus ticket down there. to help them out with some things that they need to take their things that, that the facility requires them bring. Simple things, soap, clothes, shoes, just stuff like that. Many of the people I work with are of a really low economic class, so I feel it's my obligation to at least try to help them out every which way I can, not only in finding treatment, but also getting there and making sure they're comfortable while they are there. I guess the next step that I'm leaning towards right now, I'm working on a grant right now, the Kentucky Kids Recovery Grant. I'm not sure that we will get it because that grant is specifically to build rehabilitation facilities in places like Clay County. So that's what they want that money spent on. And we have Chad's Hope here, so, but it is an all-male facility. So an all-female facility would not hurt to go here. But I've been wanting to try to get some volunteer time from someone with a degree in clinical psychology, so to diagnose these people, help diagnose people in case of any instances of comorbidity, because I feel like if we're going to treat one thing, it has to be treated holistically, not just the drug addiction. What are the underlying causes of the drug addiction? Was the drug addiction developed through other mental health issues, or did they develop other mental health issues through drug addiction? So I feel that that's where we're going right now. And if we do get a grant, that is one of the first things I'm going to do is hire a mental health professional, so we can just look through the fog and see what's going on here. Because our drug problem here is not getting any better. It's not. It's getting worse. It's getting worse, especially with the massive influx of heroin that's coming in this place, and crystal methamphetamine also. This is much different from the methamphetamine that we're used to, compared to cooking it in the bathtub and it actually coming from a lab. It's very, very different, and people are developing a preference for these illicit drugs rather than, well, I wouldn't call it a preference. They still have a preference for pain medication. That seems to be the consensus among the drug culture around here. But since House Bill 1 and Casper's come into effect, prescription medication just isn't as prevalent as it used to be. There's just not a supply for it. So they're shifting towards illicit drugs like heroin and crystal methamphetamine, and that's what we're focusing on right now. Do you guys have any questions? I feel like I'm just standing up here.
Brother, very interesting.
Anybody
I
have-
was thinking say it's really great. And the city's really, we've got our money's worth of check, I can say,
Yeah.
more than any other program that I know of.
I appreciate
He
it.
pays I mean, his salary's not very big.
Well, it's all right for right now.
He probably don't make enough to buy his gas, but travel as he does.
We do go to individuals' houses every day. I'm getting calls every single day. The 30 people I was telling you about earlier are just people that I have on file. It's every single day. I mean, they can tell you in this office, I get calls all the time, new participants every day. And that's not to say that each one follows through after they call me, because that's just not true. Sometimes I hear from them for a whole week, and then I'll never hear from them again. I have noticed that after a couple of months, after I lose contact with them, most of them will try to get in contact with me again. So that tells me that their idea of what rehabilitation and what recovery is skewed from reality. I guess it's a cultural thing. That's why it's so difficult to dig in on this kind of stuff. The drug addiction is not just simply a choice that somebody makes. It's embedded in you after so long. It's your world after so long. So we understand that, and we're here to help, and I'm going to continue to go to every house in Clay County if I have to. You know, if 5 out of 100 people make it through it, that's worth it to me. So we'll keep on keeping on.
Chad, let me ask you something. Is there an age bracket here in Clay County that's more prevalent to
Yes.
the drugs?
At least people that come to see me, the average age for a female is 27, and the average age for a male is about 29 or 30. And females are a little bit more prevalent than males. I think it was 48% and 46%, something like that. That's not 100%, but
Well, thank God for the teenagers. We're not hearing a lot about the teenagers, and that's...
well, it's the teenage part of it is tricky. It's adolescence it's very sensitive. It's very, very sensitive. From what I can tell, while they are still in adolescence, while they're still teenagers, the parents try to deal with it on their own. I guess it's kind of embarrassing. I mean, you know, it's not, but that's the way it's perceived by people. So I've only had 3 people under the age of 18, and as far as the legality of it goes, I can only point them towards some, you know, I can only point them in a direction, give them literature and stuff like that. It usually goes through the court by the time it comes to that with adolescents anyway. So, but we are the high school is not. I don't have data on it, so I'm not going to finish that. I want something solid. It's there. I don't know how prevalent it is, and I would like to get out there. I'll say that much.
You mentioned clinical psychologists, and I just wonder, like, if there'd be a mechanism somehow in partnering with health facilities here to do more telemedicine, so that you could access maybe counseling services from other parts of the state where there may be available psychologists to do some things like that may be resources to you, even though you might not have the staff on site, you could still tap into.
Yeah, actually, Dr. Jennifer Weiss, she's at PKU's Department of Anthropology and Sociology.
Yeah.
I've been working with her on this for about a week now. She's a published author. She's a wonderful anthropologist. She's a cultural anthropologist, and medical anthropology is her specialty. So we should be figuring something out pretty soon. It needs to happen fast, though.
Yeah.
We need to do this fast, because right now we are. What I'm doing is not enough right now. You know, I mean, I'm talking to these people and I'm finding out their beliefs and, you know, just who they are, and that helps out a little bit. But I'm not a psychiatrist nor a psychologist, so I can't diagnose people with this kind of stuff. First off, because I have the first clue on how to do that. Second off, because it would be very unethical to do that. So we need a mental health professional to come in here and say, yes, this person is a drug addict. He also has manic depression or bipolarism or something of that nature. That way, the facility will at least know that these people are dealing with that issue as well. And most of the time, they're undiagnosed and they're unmedicated besides self-medication. And that is just a huge part of the life of chemical dependence. So, I mean, it's very, very important that we get a mental health professional in here very fast. So that's what we're trying to do right now.
Chad, I was just going to ask, I may have missed, so do people come to you on their own, or are they referred to you out of the court system at all?
Well,
or?
I do deal with references from the court system. I haven't as much here lately. When the program first started, I was at the jail every single day. I still go to jail about once or twice a week. How do I put this? This program is not a free ticket out of jail. I mean, we need more assessment. It's not a free ticket out of jail, and you know it's not to be abused like that. I hate to be like that, but I mean, our funding is void, and Unite's funding is not that great. Their waiting list is all the way up until June right now. So I mean, that's a long time for someone who is wanting treatment to wait.
And does comp care work with any of the issues that you're dealing with at all? I mean, do they have a psychiatrist that comes there, or?
I'm sure they have a mental health professional, but I do not know.
Okay.
I do not know.
I know some comp care offices are doing more telemed stuff, which
Okay.
would be, might be a way to tap into some more.
Yeah, thank you for that. I hadn't thought of that actually. I'll check
Focus
into
is
that.
more on mental health than it is.
And I love, the prevention mechanism with getting to young people, even though you don't have the spread for high school, you gotta do something before they get there.
Yeah.
And that's so important. I mean, responsive needs are clearly there, but, a lot of community partners I know would be willing to help support you in the schools and that kind of thing. So
Yeah,
you are, even though, like you said, you can't diagnose, you're doing an amazing job of allocating all these resources. And so if you have like an assignment, community partners, I need you to do this, write it down, let us know, because I'll do anything you need to do. That's good work. It's good work.
The middle school and the high school and the Clay County Board of Education have been, they've been more than helpful. Basically, I tell them what I want to do, and they help me do it. So, they've been really into this. So, it's I'm more than thankful for the other entities around here that are digging into this. So it is. It's a. I don't like to say a war on drugs, because that emphasizes the eradication of drug use, and that's just not possible. That's not what we need to focus on. And that's what this program's been about since day one. So I'm glad that I could tell you guys what I've been doing. Again, members of the council, thank you very much. Mayor, thank you for helping get this program started. And State and Clay's also. They've been, Margie listens. Me and her talk all the time. She basically told me whatever that I needed them to do that she would do. So, everybody's real helpful and just in on this. So maybe we can put a dent in it someday. That's what we're working towards right now.
He's not saying much. The court system works with him, all the judges.
Yeah.
They pretty much, if he asks them to do something, they do it.
Yeah.
So they know that he's going to do what's right for the person, not just to get him out of jail, or like he said, or something.
Yeah, the district judges, Judge Henry Bailey Lewis, Judge Renee Muncie, and Judge Oscar Gale House they've been wonderful. It's basically, I tell them what I want and they do it. So, it's a good deal. They're also really good about assigning a time limit to recovery. I don't believe in 30-day programs. I don't. Maybe it works for some people, but for the majority, from my experience, they just simply do not work, unless it's a miracle somehow. I guess those happen sometimes. So. But again, thank you for letting me tell you guys what's going on, and that's about all I have. So if anybody's got any more questions.
Let me ask you one more question, Chad. The facilities you were speaking of that people are going to, is there a charge for that, or do you have to have insurance, or is it a private pay thing?
It's $4,500 a month for the cheapest one that I work with.
Okay.
That's why Unite is so important in this right now. Their voucher program is what is allowing these people to go. If it weren't for that, there would be no
So
treatment
it's
option.
$4,500 for each participant per month?
Yep.
And it's a 6 month?
Well, I like to see the places in Alabama that I was speaking of earlier. They work with participants a lot. After Unite's voucher runs out, they help them get a job, and they charge them $100 a week to stay there. They keep $100 out of their paycheck every week. So about $400, just like, which is good because it's kind of a sober living program. That would be just like a paid rent outside. Yeah. So those two programs they're really helpful on that. But they are the only two programs that I know of that do that. So, yeah. And we work with faith-based, clinical, secular, and faith-based and clinical programs. There's something for everyone. If you want treatment, there's a place. There's plenty of beds. There's more than enough beds. a bed for every person that wants it here. There's just no funding. That's our dilemma right now. We don't have any money to help these people. And that's why I've been trying to work on this grant. But like I said, I don't think we're going to get it. So, but as long as our name gets in there, if another grant comes up that's more suitable to what we're trying to do, then I'm confident we'll eventually get one. I just hope so.
I do want to say how proud I am of Chad. I think what he's doing is the most important thing that needs to be done right now at this point in this county. And in my personal opinion, that is the worst problem that we are facing in this county, is people being addicted to drugs. And he's doing a wonderful job, and there's such a need for it. And it's just like he says, when I'm here, there's people calling for him, and people coming in. It's people that need help, people that want help for their loved ones. And God knows how important this is to us. And I mean, I don't know how to get him funding, but if anybody does, that's something we need to do. We need to get funding to get help for these people before they die. I mean, it's obvious that they're dying. I mean, there's nothing more important than what Chad is doing.
It's it's drug addiction has just took so much potential from this place. I mean, there's very intelligent and people that are blessed with a lot of talent in Clay County that just do not do anything. I mean, we're not down on the evolutionary ladder in intelligence or anything. There's something causing this, and I'm like Margie. I think this has a lot to do with it. It may not be all of it, but I think it's a large portion of it. So.
I've got one comment. Perhaps anybody could set up a bank account where people can contribute to this cause and advertise, disseminate the information out, what you're doing, and maybe the local citizen would contribute funds to that account that can be used for this purpose.
Okay. If we done something like that, that will be set up through the city. This is a city program.
It's a city program?
Yeah.
Oh, okay. That's one thought I had.
That's an idea.
That's an idea.
That's a good idea.
Yeah, that's a good idea. I mean, if people want to donate, we will surely take it.
Oh, no doubt. And,
yeah.
And anybody want to contribute some funding for your expenditures, that'd be great. I'm sure you appreciate anybody wanting to donate a little something for you. Okay.
Well, yeah, I'd appreciate that, but I would dread if people donated.
To the program, yeah, I
to the
understand that,
program.
yeah.
Yeah.
Chad, have you found that when they go to rehab, it's usually a recurrence to keep them clean?
It's a struggle.
It is a struggle. I have a granddaughter that we had 5 places. I can tell you places because we had her in 5 places, and it took maybe the 6th place before she's come. Now she's doing great.
Yeah.
Doing good. But nothing is in her favor. People don't want to hire these people to help them. They are afraid of them.
Well, there's the stigma around drug addicts.
There is.
Yeah, I mean, it's there. It's hurtful too. But as far as recovery goes, it's just like I tell all my participants, the rehab facility is just a building. It's just a place. I mean, that's it. It's somewhere we
It's
can
got to
go.
be in their mind.
Exactly. It's some place that you can go and you can get away from, you can be in the comfort of obscurity, basically. It's not possible, it's not around, so it's very easy while you're in a rehab. When you get out is the real test. That's the big part about it. That's why I also try to work with facilities that have at least a year aftercare program. Now what that means is they call them, check up on them. They can't go drug test them or anything like that, but I mean, it's just, if somebody knows that somebody else cares, that is a huge bump. That's just big. So, that's what we try to do.
Chad, if I could throw my 2 cents in, I hope you guys don't mind. I've known you for a long time, and I have to agree with Miss Margie over here. I I'm so happy for what you, I've preached this and you're doing it. Thank you.
Well, thank you. Yeah, if you guys don't know, I was a drug addict for about 8 years. I was pretty horrible. I lied, cheated, stole, and, you know, everything. If you're from Clay County, I'm sure you've heard of something that I've done that I'm not proud of. But, you know, that's why I'm doing this, so.
It takes somebody that's been there to actually know how to everything.
Well, yeah, I agree with that. I agree with that. Is there any more questions?
Well, you said you didn't want to call it the war on drugs. We couldn't eradicate them or this and that. Now, October 22nd, my son, Ronnie Jr., be dead 3 years. He went to celebrate recovery, totally clean. Came back to Curry Branch one day, got back with some of the old cronies. Now, if there'd been a war on drugs, the dealers wouldn't have been there, he'd still be alive. He just took the one pill. He thought he'd been used to taking that stuff.
I'm sorry for your loss. I really am.
I appreciate that. I mean, there's got to be a war on drugs. They got to be eradicated, and then that's the law enforcement.
Yeah. Well, I mean, as far as you know, for every drug dealer they bust, there's going to be 2 more pop up. You know, that's it's a socio-economic thing around here. Drug deal, there are no jobs here. The coal mines are shut down. There's no factories here. There's no industry here. People have to do something to make money, and unfortunately, a few of us choose to sell drugs. It's easy. It's fast money. It will always be around.
Well, it seems to be that the people that actually needs drugs can't get them, but the people that are selling them, they're unlimited supply.
Well,
So
you're exactly right. But thanks to House Bill 1 in Casper, that has been cut back tremendously. It's still there. They're still there. I can tell you that the prices of prescription pain medication have, I mean, they're ridiculous now among drug users. For the illegal sales of them, they're ridiculous. They're very expensive, which scares me. If anybody remembers the Oxycontin boom that we had for about a decade, I mean, it was awful for around here. Everybody was stealing, everybody was, I mean, doing whatever they could to get a hold of some money. So, I mean, I wish that we could eradicate drug use, but in Western medicine there's no way. It's not possible to eradicate drug addiction around here. It's just not.
Well,
our doctor system, our medical system is a huge part of that. And I'm sorry, Ms. Clark.
It's okay. Lots of people think Suboxone's going to get them off of it. I can tell you one right here. It is not. It's just another drug. And it makes them want more. You know yourself that how the Suboxone has gone. They've had a lot of clinics, and I'm not speaking bad about the clinics. It may give some people a hope, but most of the time it doesn't. It just gives them a...
It's just swapping out one for another.
Yeah, one for you're just swapping out.
Yeah, the methadone clinics and the Suboxone clinics have done more harm than
They
good
have.
around here. It's you know, they're shooting up Suboxone now. They're shooting up that. That's the preferred method of consumption around here now.
And it's
Which,
expensive.
Yeah.
Very expensive.
Which brings us to another bad deal. I don't know. I don't have any fancy words for it. It's just a bad deal. Is the increase in hepatitis C and other pathological diseases that goes with IV drug use. I mean, you know, it's going to get bad. The jail sees it right now. People coming in with hepatitis C. As small as our population is, it's going to be a pull for it. I mean.
Chad, if I could just add, I do infectious disease for the health department, and you are exactly right. I couldn't even tell you the number of confirmed cases I get daily. It would shock you.
Probably more every day.
Yes, every day, every single day.
I believe that it has a lot to do with the IV drug use shooting up. Dr. Merrill Singer, a medical anthropologist, pinpointed that in Connecticut about 15 years ago, or 20 years ago maybe. He wrote a book about it, and that was, once they focused on that, the IV drug use, hepatitis C, the rates anyway, went down. Do you know who Dr. Singer is, Dr. Merrill Singer? Okay. He's at the University of Connecticut right now. He started the Clean Needle Exchange program over there, the one Vancouver is modeled after. So, or maybe it's modeled after Vancouver. It's one of those. But their rates of hepatitis C and HIV and AIDS just, I mean, got cut in half. So.
Yeah, but in Kentucky, you can't do that. To get a hypodermic needle, you must have a prescription.
Yeah.
They will give you your insulin, but they will not give you a needle to take it with. So therefore, if I use a needle, I wipe it off and give it to Jack, and he uses it, wipes it off and gives it to Vernon.
Exactly.
You know, that's your trouble with the hepatitis.
Yeah, that's what I'm saying.
Epidemic.
People think that you can sterilize a needle, but I mean, you know, you can burn it, you can soak it in alcohol, but there is something in there that can potentially get into the other person's blood system.
We've legislated them into sharing needles, exactly what we've done.
Yeah, I mean, you know, the Clean Needle Exchange program, it's a bit radical. I mean, you know, basically what you're doing is you're supplying drug addicts with a method to get high. But, I mean, which weighs more? A hepatitis and HIV and AIDS outbreak, or giving people clean needles? I mean, you know, I'm not up here arguing for that from Manchester, but I mean, I'm saying, you know, that's what other parts of the country do.
Well, if you have to get a prescription for them, then how do they get them?
You do not have to have a prescription to get a needle.
I guess you do.
No, I've been
Call Gary Highland.
Well, I have taken 7 shots a day for 17 years, and I have never had a prescription for my needles. I go to Walmart's, I give them my driver's license. As long as I sign that I'm using it for that purpose, that's the only prescription I need.
I know
about 200 every month.
Oh yeah. I know one person that I worked with recently who is in a facility right now.
You're saying, Vernon, you get them without, just show them your driver's license.
I have never had a prescription for it. I've been taking it using it for 17 years.
You're a Highland tells me you got to have a prescription.
Opened up this dryer, and they was a garbage bag. It was that full. This is no lie. Nothing but syringes.
Really?
Yeah. I don't know how they got them, where they got them, what.
If you'll pay attention, you'll see syringes laying on the side of the road around here. I mean, you will. I see them every day in people's yards where I go talk to these people.
They're not just shooting up what you and I are talking about. They're shooting up everything.
Yeah, they're shooting up.
That's
what what I was saying. IV drug use has become the preference of consumption around here. It's faster. It gives you a way better rush. It just gets you high.
They said they're shooting up between their toes and between their fingers.
Anywhere there's
Anywhere outside where people can't see where they've been doing it.
Yeah, it's a problem.
In their feet, anywhere they can get a needle.
What this tells us, though, is it's not an individual problem anymore. It's a community problem. You know, correct. We don't want somebody getting put with dirty needles that you know.
Jack, can I ask you one more question real fast? Yeah. I'm going to like to back up just a little bit about the drug dealers. You know what you was talking about, you know, how you get rid of one, then 2 more pops up. You're right, but that just means we got to work twice as hard.
Well,
you know what I'm saying?
Yeah, I mean, yeah, that's absolutely correct.
I think the starting point is education with our smaller children.
Yeah, that's right.
Letting them know, you know, they're going to see it on television anyway. You might as well bring it in and tell them this is bad.
Yeah.
It's not good.
Oh, speaking of which, I forgot to mention this. I also offer a program. I tried to have a addiction education class here. It's modeled for parents who have never had any kind of problems with addiction, doesn't know what it looks like, how and when to open up communication with teenagers, environmental risk, home risk, peer risk factors, just anything and everything preventive that is centered towards teenagers.
Now it's too late.
But nobody showed up. So, but it's still, I'm still offering it. So if, you know, if you guys know anybody that has small children, teenagers, and they don't know anything about drug addiction, they've never done anything like that, send them my way.
We, it'd be good if you could get something on paper that
Yeah,
people
sure.
know about that, like
Yeah.
a press release or something.
Okay, yeah. And another thing, I hear people every day, you're wasting your time on that, you're wasting your time on this. I just want to say, if anybody thinks that there's no hope for somebody, send them to me. We'll try our best to get them out of here and try to get them help. So, yeah. But if that's all, I got to get back out. I got to